I'm going to talk about coherence. And the neat thing about coherence is that we just don't use it. When I learned about coherence from Oakley and Jim and the team, I thought, I can see connections. And this is amazing because you can't see connections on an MRI. All you see is a picture, it's a photograph. So you can see where the damage was, but you don't know what's talking to what. So we started using coherence in my clinic and in the inpatient as well. And coherence is known to be a measure of connectivity. So I want to know what's connected to what, and more importantly, what's not connected and should be. And finally, how can we get it to connect? So I had been working on that without any feedback, but the coherence with the WAVi really provided me that tool. So let me explain to you how this works. And I'm going to present 4 cases, and I'll try to go through it quick because I wasted a lot of time talking about that. So this guy is 60 years old. He was injured 23 years ago in a motorcycle accident, not wearing a helmet, of course. And I don't know how it happened, but he got flipped on his motorcycle on the feeder road, which is on ground level. He ended up on the overpass, and must have been a heck of a hit, and his brains were leaking out the left side. So they scraped him back together, put him in the hospital, and he had a fairly long rehab course. He wasn't my rehab patient at the time, but he actually recovered pretty well to where he could do his own ADLs and he could move around. And so I thought, okay, this is a perfect patient. Let's do a baseline WAVi on him. Let's see what his connectivity is, and then we'll follow him over time. So this is his baseline WAVi. And I don't know if any of you guys know anything about coherence, but WAVi has the 4 wavelengths. There they are. So this is beta at theta, beta. And so what you're looking at is a graphic in each wavelength, and we're looking down on the top of the head. And each of the black dots is the electrode in the WAVi helmet. And what the computer does, just thanks to Jaffe and Oakley, is it figures out which electrodes are synchronous, which pairs are most likely talking to each other. And I know that's a real basic, and if Jaffe heard me say that, he would just castigate me. So, but that's really the bottom line, is these electrodes have lines drawn between the different pairs in all the wavelengths. So the top of each graphic is the front of the brain, the bottom is the occipital, and the right is the right, left is the left. So in each wavelength you look at this and you can see, okay, let's see what happened to this guy on his baseline. Well, it was obviously his left brain that got leaked out of his head. So you don't see a lot of connectivity on that left hemisphere. And the same here, it's pretty sparse, and over here in the theta as well. So I thought, that's great. We started him on my neuro protocol with my supplement and sent him home. And he came back in 4 months, and we did another WAVi. And that looks like this. So the top 4 are the baseline. The one underneath is the second WAVi. So you can see there's a lot of changes here, right? We have red lines. Those red lines mean that there is 100% change from the baseline, which is really interesting to see. I know now that I made new brain in this guy. Not only that, but he's riding his bike. He's minding his wife. He even drove his bike to Sturgis and made it all the way back through Dallas traffic, and she didn't have to go find him. So she's tickled pink, and he's just made all kinds of progress since. So he's still taking the stuff. All right, here's my second case, and this is a case of a 28-year-old guy was walking down the sidewalk, minding his own business. He was in Denver, and he was just going to go out for a beer with his buddies, and somebody came up behind him, hit him in the back of the head, and when you do that, right at the base of the skull, there is no connection between the brain and the limbs. So you go down like a sack of potatoes. You can't catch yourself, and he hit the back of his head on the concrete. And he ended up with the coup, which is down here in the occipital region, and there's a skull fracture you can't really see on this CAT scan, But the contre-coup was much more serious. So he has a traumatic brain injury, a disconnection syndrome with all these axons, and he's got a stroke, a hemorrhagic stroke. So this was the original, and then this was 7 days later. So it's starting to get a little edema, some of the blood's beginning to resorb. He's still got some edema down posteriorly. So this is his baseline WAVi. I've got all 4 wavelengths, and you can appreciate in that front where the contre-coup was in the blood, there's some holes in there. There's not a lot of connectivity, although you could make a case that there's some, but you can really see it on the delta. So I made a deal with him. We started him on my protocol, and we did a second WAVi. And I already told you, the red lines are 100% changed from baseline. So that means those are new connections. So look at the delta. That's just completely effusive with that. That's great. Now we've got new connections coming from the posterior area of the coup all the way across toward the front of the brain. And Hemorrhagic actually saw this in his concussion patients. The initial phase of healing is these long connections all the way across the brain. And so we saw that, and okay, it's only 30 days out, and this guy had been injured 6 years ago. So the other guy that we had just talked about, his injury was 23 years before we put him on this treatment. So when a neurologist says, well, you've had a stroke, you'll get some function back in the next 6 months, but after that, what you got's what you're probably gonna have. That is completely false. Now, you wouldn't see this on an MRI. There's no way the MRI is gonna show you these connections, but you can actually see where the coup and the contre-coup is. See, there's a contre-coup, and again, pretty devoid of stuff, both on all of these, but on the right side of the brain, you get continued repair work done. That signifies axonal reconnection, because any kind of traumatic brain injury, there's axonal disruptions you can't see. You can see holes in the brain from strokes and stuff and on scans, but you can't see the axonal disconnect. And so what this is telling us is that the body is trying to sprout new axons from this left side that was completely disrupted. So I made a deal with him that he would come back every 30 days. So we did another 30 days. And you can see at the 30-day mark, look at all of that red coming in. So the whole right side of the brain is filling up. And these connections are starting to shorten up, just like Hemorrhagic talks about in his paper. And we're instead of these all across the brain long connections, now we've got some short inter-electrode connections. And of course the delta's filling up. And of course Oakley will tell you that's mostly noise. But I can tell you, I'll show you in a minute, I don't think it's all noise. So this is the coup, right? Or this is the contre-coup up in the front. And this was the coup. And the coup and the right side of the brain are really doing a lot of repair work. So that's pretty powerful. So we did all of that, and this guy asked me, well, what's it gonna look like in 6 months? So we did a 6-month repeat. So in 6 months, look what you see. Here we've got this brain kind of normalizing. Oakley was talking about how normal frontal expectations on this coherence. This is about what you always see. So that's normalizing. You've got these other neurons, they're also normalizing, but you still got repair work 6 months out from a year that's from an injury that's 6 years old. It's still fixing itself 6 months. And he had stopped all the supplements after that third WAVi 6 months before. So he's still making connections even though he stopped the protocol. And look, delta, this is why I think there's more going on than noise in delta. So you're seeing, I think, more repair work going on in the delta wavelength. So that's my 28-year-old. I think that's pretty impressive. Not only am I able to see reconnections, but I'm able to see where the damage was. The MRIs don't show you that. CAT scans don't show you that. So this opens up a whole new door. Now I've got a dependent variable that I can look at. I can watch repair. Did my intervention make a difference in the brain? Well, I was already hearing that from the therapists. They were tickled pink. And they'd come to me, and I can't believe his injury was 6 years ago or 20 years ago. He's really starting to move a leg. He hadn't moved in 20 years. So I knew it was happening, I just didn't have any proof. Here's an ALS patient. So we've seen hundreds of these people over the past several years. And this is Bulbar ALS. I don't know how much you know about ALS, but it's a horrible disease. And Bulbar has the worst prognosis. It's about 4 to 5 years survival after diagnosis is made. I think his diagnosis was made in 2019. And he's like in his 50s, and he began to lose motor control of his tongue, having trouble swallowing. He was mumbling, I could hardly understand him. So it was clear that he had damage to the Broca's area in the brain. So we did this baseline. So you can see there's not a lot of connectivity, especially on this left side. Well, what part of the cortex controls the tongue and the larynx? It's the left side of the brain in Broca's area. So that's where he was losing his connections. So we decided, okay, let's put him on this stuff and let's see what happens. So we started my protocol, and this is his second one. Now look what we've got. He's turning red everywhere. He's a Republican. So, and look, he had to have both hemispheres. The neat thing about speech is that not only is the motor over here on the left that's predominantly controlled, the tongue and the larynx, but it has to connect to the right. So you got motor control on the left, but the right side gives you color and speech and meaning. And you integrate all of that so that when you talk, you're actually able to express what you feel, and you're able to change the intonations of your speech. And I think this is a representation of one of the most severe degenerative neurologic diseases, and we can actually make a difference. So what happened to him? Well, he did really well. But the difference between this baseline and this is 18 months, because COVID hit right after I got the baseline. So he didn't come in. But he kept taking all of the stuff that I told him to take, this product that we used, and he was faithful about it. So when he called asking for another appointment, I could understand it on the phone. And he came in and he said, "I'm doing great. I'm starting to play golf again. I can swallow." So, I mean, talk about a victory. So that is amazing. And no talk is complete without looking at dementia. And here's like an 84-ish patient, and she had a pretty progressive dementia. Look, there's not a heck of a lot going on in this brain in any wavelength. So we started her on this program, and every 30 days, we did another one. And look at every 30 days, there's this progression of reconnection. And this is in an 84-year-old demented lady. And it's absolutely, it's really moving to see that. Right now we're doing some research with the University of Houston and Clear Lake. Clear Lake is really neat because I've got NASA right on the doorstep of University of Houston and Clear Lake. So I have a 3-year research grant there, and we've got one IRB approved for looking at the neurochemical effects in Parkinson's specifically. But we have a second one that's pending on inpatients, and we're looking at neurochemical changes and optimization in all kinds of brain injury. So that's going to be an interesting study to do. That's what we're about in Clear Lake. We've made amazing gains. I'm working with some amazing doctors over at the University of Houston. I love doing that. Getting back into research after years and years in clinical. But in those years in clinical, I never stopped trying to figure out how could I make this work? How could I get these stem cells to morph into neurons? So I finally decided, okay, I got to write this down because I'm going to forget. And I'm going to lose all of this. So I wrote a book. It's called Fixing the Broken Brain, and it's out there on the table. And the moral to the story is chemistry plus therapy equals recovery of function. So I use all of those therapies, and I supplement with things that I know with these amazing interactions between the sigma-1 and all the cofactors and the neurosteroids and everything I use that makes new brain. I can prove it now. I've got objective data. And it's just like a young girl learning how to play the piano. She doesn't really know at first what to do, and she's sitting at the piano. She may be 6 or 7, and she's trying to figure out, and the parents are in the back room with their ears plugged. But over the next 2 weeks, she's got it down. And the parents are going, phew, finally. And this woman, and think about the marvel of this. She will never forget that piece of music. For 60 years, she'll probably still remember it. She'll probably still be able to play it for her grandkids. And you got to think, how did we do that? How are we able to make new neurons, make connections, and how they can last with long-term potentiation? How do we get that to happen? So the book covers a lot of the science behind that. How does a stem cell become, and there's a lot of science in the book about how the different neurotransmitters play together and stimulate that stem cell to say, hey, okay, I'm not going to be a baby. I'm going to get out from this nursery and I'm going to become an adult stem cell. And that's what we've been doing for a long time. And I just don't want to give this up. So it's, excuse me, it is an amazing feat, I believe, to be able to show objective data that says we can actually make new brain, and it's functional brain. And there's no MRI that's going to tell you that. There's no functional MRI that's going to tell you that. There's no DTI scan that's going to tell you that. You can only get it with something like this. And so that's what I wanted to present today. In the book, you'll see a whole lot of biochemistry. I mean, it's understandable, because I'm trying to write it for both the neophyte and the average person who's worried about their mom losing their memory. But I'm also trying to show the scientists that this is important. This is actually, there's a science behind it. In the back of the book, I have 450 references. That's a fraction of what I reviewed over the past 40 years to put all this together. So you're welcome to go through that and find some of these studies and read them for yourself. But what we've discovered, I think, is really remarkable. And I'm very thankful to WAVi and for that silly meeting that we're all kind of hanging out together with booths next door. Go ahead.
So, thank you very much. That was a brilliant presentation, and the book is even more brilliant because it's great. I got about halfway through it. It just makes sense. So thank you for putting that together. Now, when I tried on my multiple patients, I had a patient who had a fairly large astrocytoma brain tumor. Removed 15 years ago. She had speech deficits and some motor dysfunction. We did a WAVi on her ahead of time, and then 4 months. She came into the office, and instead of speaking with a halting voice, she said, "Hey Frank, it's so good to see you." And I just stopped in my tracks.
Yeah.
Her walking was markedly, totally improved. And we did WAVi, and there was an interesting, marked increase in what I can see as both motor function as well as connectivity.
Yeah.
So that's number one. And I had another patient who had his wife, brought him in. He was 85 years old, and she said, he's not been functional for the last 4 years, but I hear you have some stuff that you might be able to do. So I did a WAVi test on him, looked at him, and oh my God. Of course, I mean, his WAVi test for the frequency analysis as well as the amplitudes on the B300 were markedly reduced and shifted to the left, all into the delta range from the frequency. And 4 months later, the guy goes in and goes, "Hey, Doc, this is pretty good stuff you got." And I'm going, "Whoa." And his wife said, "I think I had my husband back." And WAVi was markedly improved. It was a 100% increase, if not a little more, on each one of the P300 amplitudes, as well as a beginning of specific frequency spectrum improvements in around around 7.5, but that's better than like Zippo. And so, you know, you're not going to cure them, but you're going to make them a lot better.
Yeah.
The guy stays on it now. So I just, congratulations.
Thank you very much for that. Appreciate that. Thank you.